Thank you for joining us today. Today's health briefing is part of a series of briefings focused on presenting real-time COVID-19 healthcare data specific to vulnerable and at-risk populations in South Central Pennsylvania communities, including York, Lebanon, Lancaster, Hanover, and Gettysburg. This briefing is presented by Family First Health, a leading regional healthcare organization serving at-risk populations for the past 50 years. Family First Health is a federally qualified healthcare center serving more than 20,000 patients annually. We invite you to submit questions in the comment section of this video post or by emailing healthbriefings@familyfirsthealth.org. Copies of this video briefing will be made available online at familyfirsthealth.org shortly after each briefing. We will begin momentarily.
Good morning and welcome to Family First Health, another edition of Health Briefings. I'm Jenny Englerth. I'm President and CEO of Family First Health, and I'm really pleased to be here today for another opportunity to share timely and important information, health-related information with our community. Joining me today is Dr. Marie Kellett, who leads our Columbia Center. She's a family medicine trained physician and also is director of our integrative care programming. By that, we mean integrating primary medical care, behavioral health, and substance use disorder treatment. I'm really excited to talk with Dr. Kellett today about a really timely topic, one that we're all navigating through, which is how we emerge from the life we've been living over the past 14 months under the umbrella of a pandemic, and kind of what's next for ourselves, for our families, and how we make good decisions about how to navigate anxieties and concerns that may be associated as we re-engage as a broader community. So Dr. Kellett, welcome. It's great to have you with us this morning.
Thank you, Jenny.
So we're going to start out by talking to give us a general framework from your perspective about the impact of long-term stress on our physical health and our mental health. So just from your knowledge and training under any circumstance, what does that look like? And then we'll talk specifically about impact of something like a pandemic that's so long-term and has carried such implications for all of us.
So Jenny, anytime the body undergoes stress, whether it's a small stress or a large stress, it takes time to recuperate and to heal. Obviously, the bigger the stress and the longer that stress is imposed, the longer it takes. I'll just speak from my personal experience. You know, I was hit by a car. I was 25, almost 25 years ago. I don't think I fully recuperated from that for over a year. I think it just takes a lot of time. I didn't feel like myself for a very long time. And I think that anytime there's a major trauma or a loss or grief, it takes a long time for people to recover from that and to feel better from that.
And how specifically, what symptoms, you said in your example, you didn't feel like yourself. What are other ways that you have heard patients describe the kind of physical and mental impact of a stressful situation?
Well, sometimes people recognize that it's the stress that's causing it. They're tearful, they're sad, more of those mental health components. Sometimes they're in my office 3 and 4 times with chest pain and we're not finding a medical cause. Sometimes it's physical ailments, their body hurts, they're achy, they have joint problems. And again, this is the way our body deals with stress. The further we move away, the better that people feel. And grief does the same thing. So when you lose a loved one, the best example I've ever heard about understanding grief is that imagine you're sitting on the edge of the ocean where the waves are just pounding you and pounding you and pounding you. And as your grief progresses, the waves spread out, but the pounding still comes. So it still will hit you very hard and out of the blue sometimes. So you think you're doing okay, and all of a sudden you're not. And that's the kind of, for me, the best example of grief. And that's what trauma is. It's a type of grief.
Right. No, I really, I can appreciate that example as well. So now let's apply this to COVID. You typically in your office may see situational or very short-term impacts of trauma and grief. We've had over a year for all of us of grief, of loss, of change, of isolation potentially. And so what comes to mind for you as a physician as you are seeing folks within your practice, and how the impact of COVID may be different and or similar to what you just described?
So in the ways that it's different is that this has affected the entire culture. This is in the entire world. So this is kind of ubiquitous. This is everywhere. And so we took people who were living maybe at this kind of level of stress, and then you would go up and down, and everybody went to here and then up and down. And so their reserve is a lot less. And as we're kind of coming out of this, we've neglected health concerns. We've neglected, going to seek care or getting our mammograms or getting our pap smears because of fear and anxiety. And so when we live at kind of a higher level of stress constantly, we have less reserve, and it's going to take a lot longer for us to come down to where normal felt.
No, that makes sense. Are there differences that you see in your practice in this impact between children and adults, or what should we, I'm asking this question for everyone who has a child at home with them. What are things we should be thinking about for ourselves as adults? And then what should we be thinking about for the young people in our lives?
So I think, let me start as a parent, because as a parent and as an adult, our children gauge how to respond and how to act from us, especially younger ones. Teenagers, not quite as much because they think they know more. But, I'm a mom of 5 boys, and they look to my husband and I, how should we be feeling? How should we be reacting? And if we're anxious and we're worried, then that's where they are. So I think that as a parent, we need to very much recognize that our children's responses really are modeling our responses. So if we want them to be doing better, then either we have to pretend we're doing better, or we really need to get that health and do better ourselves. I think that stress for kids presents a little bit differently because some of them don't have the verbal skills or the knowledge to be able to express that. So it may come out that they're having nightmares. It may come out that they're fearful for you to leave. My 6-year-old, who has had no problems separating from us, my husband and I went to dinner on Saturday night, and he cried and sobbed. And that's not a normal behavior. So that's just one of the ways that kids can express stress. And we have to recognize that they just express it a little bit differently. Now for the adults, it's being short-tempered. It's being just a little more fearful, a little more anxious, little unsure of kind of where you are and what your next steps are. And so I think that there's lots of room for all of us to improve and to feel better with that.
Yeah, that makes so much sense. And, can you speak to a little bit, one of the things that I've noticed myself is the variability around us, right? As we kind of emerge from this pandemic, knowing that the pandemic still exists in our community, and we're still concerned about some level of risk, but we've certainly come a long way in the past 14 months. But there's this variability about how we navigate and what behaviors are okay and what are not. How does that add to the stress that we have, and how might we think that through a bit?
So I think, mask wearing is a really good example of the variability that we see. You and I briefly talked, Jenny, and sometimes it feels like there's maybe more mask wearing now and than there was a year ago. And so, and there's a lot of judgments passed. So, if you're vaccinated and somebody's wearing a mask, does that mean they're not vaccinated? Does that mean they made a different choice than you? Does that mean they didn't have access? Does that mean that they're afraid of getting sick? Does that mean they have a health concern? Like, there's so many what ifs. And so we make these quick judgments, and they may or may not be accurate. So I think as we learn to navigate, and, when someone wants to give you a hug and are you comfortable with that? Are you not? Or shake your hand? That actually, I think, leads to more stress in our lives. And how are we going to deal with that? And until we reach kind of a plateau on wherever we're going to end up, I think that those stresses are huge for people.
Yeah, so I would guess that some pre-planning might help, but there's still going to be situations that we find ourselves in that we couldn't anticipate, right? So when we feel that anxiety kind of creeping up for any of us, what are some strategies that have been successful within your practice? And then we'll talk about more maybe significant examples. But if we're just feeling that kind of in the pit of your stomach anxiety in a social situation or in making a decision about how to navigate over the next few months, what might be some strategies that might be helpful to manage in those situations?
That is such a great question, because it's something that we all are navigating now. Those butterflies in our stomach that used to happen just before maybe public speaking are now like when you get out of the car at the grocery store, like those physical symptoms. So there's a couple of things that I have found hugely helpful. And I'm going to put number one, exercise. Moving and movement and getting your heart rate up and sweating will release endorphins, which help you feel better. And so exercise is number one. And good sleep, trying to get good, 7, 8, 9 hours of sleep, whatever works for you, to not neglect some of those things. I am a huge fan of limiting screen time, and that screens, first of all, right close to bed, make it so you don't sleep well, but otherwise, and you talk about our kids and engaging through screens, we spend an inordinate amount of time in front of screens that both for work and for pleasure. So those sorts of things. So that's the big picture kind of things. But when you're feeling like, you got the butterflies in your stomach or the pit in your stomach, there are some really great quick techniques that you can do that basically are being mindful of your surroundings. It's you can take deep breaths, in for 2, out for 5, or just kind of trying to relax. But also there's one that's called grounding. I love grounding exercises. And that is just visually see what's in your vicinity. I see a light, I see a screen, I see paper, I see the floor, I see the ceiling. Those are all very real, concrete things. And when you acknowledge the real and concrete, some of the other stuff will melt away. So those are some of my, breathing and grounding are very simple techniques that anybody can use when they're feeling anxious.
Yeah, thank you for those reminders. I agree. I think grounding can be really helpful. It's something we use in our house and have talked about a lot this past year. So good reminders on those things. Now let's talk about when situations become a bit more pervasive. And one of our intentions today was to talk about the role of a primary care provider in helping us navigate the coming months. And you've already shared some insight. But I think about those things that are becoming more pervasive. You talk about sleep. What if sleep just isn't coming for someone, no matter what they do? What if anxiety is becoming a deterrent to activities that a person enjoys? Those might be the situations that drive someone to make an appointment with their primary care provider. So could you talk us through what folks should expect in that case? And then what you're seeing in your practice, and maybe go a little bit deeper about some of the strategies and supports that may be available through a primary care provider in this case.
Okay. So yes, those are definitely reasons, people not sleeping, acid reflux is a really big one that we see, just, the stress and maybe more caffeine than they're used to because they're not sleeping well. So there's a lot of physical complaints or semi-anxiety related complaints like the insomnia that will present to your doctor. And whereas some of the case, I can give you medication, I can relay those fears, but a lot of the behavioral health componentry is very helpful. And so I love the system that Family First has and integrating our behavioral health into the office. So what that means for people who would know is that if I'm seeing a patient in the office and I think they would do well talking with someone briefly or longer term about stress, anxiety, insomnia, acid reflux, obesity, diabetes, whatever it is, I get to knock on my colleague's door and say, will you come talk to this patient? And then they can have that immediate connection and then have follow-up from that. And sometimes that's 2 or 3 sessions and all of a sudden they feel so much better. And sometimes it's, oh no, we need to work on more of this, and then they can get referred out. But it's just such a wonderful gift to have in the office, to have somebody with that expertise that and a lot of times the patients don't even recognize that that's what's going on. They don't realize that what they're feeling is really anxiety, or that they're feeling maybe some depression, or that, the grief that they haven't been able to process is manifesting in whatever physical way. But having someone there, if I can kind of funnel them that way and then have someone right there, we've removed the stigma of going to a counseling office, and we can start some of those interventions pretty quickly.
Yeah, I think that timeliness is one of the many assets of our integrated model. Sometimes when there's that opportunity, right, when someone has presented to you, that's the moment that we need to capture, versus kind of pushing that down the road where someone might have more hesitancies. Can you just pause and reemphasize what you said about stigma? I think this is something that maybe this navigating through this pandemic will help us address going forward, that stigma around mental health and even substance use disorder treatment it's high time we move past them. And so if you could just emphasize that a little bit more, and the impact that you see that stigma has on your patients and their ability to access care.
So stigma is so real. And, for any patient who's never sought any mental health, to walk into a counseling office it takes a lot of courage. And because they feel, maybe I'm imposing some views, but they feel like they should be able to handle this on their own. They shouldn't have to seek mental health, that, or maybe they've struggled for that long. And so by starting that in the primary care doctor's office, nobody in the waiting room knows why they're there. They could be there for a sore throat. They could be there for whatever. And so by taking that stigma out and introducing and getting people to feel better is huge. And in substance use, it is absolutely the same thing. To be able to talk to your primary doctor that you have a problem with pain pills or alcohol or heroin or whatever drug in a confined, in a safe environment, and be able to start getting help there. Again, it's a huge thing to remove those barriers. And we know that pre-COVID that this was necessary, but I'm going to say during and post-COVID, this is huge, because we know, okay, so for essential workers, those people who were on the front line, I think it's over 30%, 35% have sought mental health treatment since starting COVID. That's compared to 12% of the regular population. So those essential workers who have put themselves out there need help themselves and may or may not be getting it. And we know that the substance use and overdoses and people who relapsed or turned to alcohol for the first time or drugs the first time during COVID as a coping strategy, those people need help too.
So you're making me think that this is kind of long-term, right? So we've spent the past year steeped in trying to understand this pandemic, how to respond to it, developed a vaccine, had that opportunity, continue to have that opportunity. But this, the tail or the aftermath of a pandemic is not going to be something that by the end of summer we've wrapped up and taken care of. Is that accurate in what I'm hearing from you?
Jenny, I'm not even sure in 5 years we're going to have wrapped up and taken care of all this. It's so for the people who have been lightly touched, or you're still dealing with that anxiety that has happened through COVID, the uncertainty, the fear of death, people who have lost family members, and you have that grief and you couldn't have a funeral, or even the high school graduation that didn't happen, or the sixth grade graduation that didn't happen, or the Sweet 16, or the Happy 50th, or the whatever. We've missed like a whole year of special occasions that, that's just the specialness of our life. And so when you take all that away, I think that it's just going to take a long time for people to heal from this, knowing that it's possible and that it will happen. And not everyone has been affected this way. There's people who are like, yeah, it's fine, no big deal. But I think most people have been affected more than they could even imagine.
Yeah, I think there's layers, right, that we'll move through over time potentially. Before we wrap up, I just want to make sure that we cover those kinds of behaviors and responses in our kids that should help raise a red flag for us. I know that through this past year, we've all maybe had opportunities to be concerned about our kids, but there are some things that may cause that to kind of go to the next level. And we do want to make sure that our kids are getting the care and treatment that they need as they navigate this. So could you just review for us those things that you would spotlight as a primary care physician that should cause a parent pause and likely prompt them at least checking in with a professional about what's best for their child as they navigate this time?
So there's obviously like huge red flags. Any thoughts of self-harm, any thoughts of suicide, any thoughts of harming someone or yourself. Cutting is a very big thing among teens, and not as a suicide attempt, but just creating pain. So those things, absolutely red flag. Crisis is what we need to do. But there's a lot of other pink flags, maybe, that are really concerning too. And that's when sleep habits change, when the mood, you had a pretty generally happy child and now they're not. You have people who, kids who don't want to go play outside. They don't want to go to the store. They are sort of fearful about those things. Those are all really serious flags as well, that something's brewing underneath, that they need to seek more help. And unfortunately, with so many kids being virtual schooled for so long this year, they didn't have as much access to in-school counseling and things like that. So I think that we just need to keep an eye out for some of those behaviors that seem out of character, is probably the best way to put it.
Yeah, thank you for those reminders. And knowing that, I think an additional reminder, we've talked about our integrated model. A primary care physician or pediatrician is always a place that people can start if they're concerned about the children in their lives and start to navigate. Because there are some complexities at times when we think about services for kids, but your primary care provider is a great place to start the process if you do have concerns. So we've talked about a lot of things, but just to reiterate, it sounds like some of your expertise has been reminding us that this is going to take some time and that patience is going to be required. And then you've also shared some tips to help us kind of navigate some of the situational opportunities or things that we might be experiencing. What else have we missed, Dr. Kellett? What would you like to make sure that people know and understand about this time and their potential interaction with their primary care team?
I really want people to know that this year 14 months has been hugely traumatic for just about everybody. I think we need to not overlook kindness and generosity with one another and patience. But I think that starting if you have concerns about your physical health or your emotional health, that starting with your primary care doctor is a really good place to start. And then they can help navigate whether you need more services or not, or you should hit the gym, or you should be in nature, or, spend time in meditation. All of those things are truly very beneficial and helpful, but sometimes you need a nudge to kind of get there a little bit.
Yeah. I want to pause for one last comment that came in that asked about nutrition. So we've talked about movement, but I know that you're a strong proponent of the connection between overall health and nutrition. So as we close, could you give a few pointers about nutrition's impact on managing stress and through this time?
So Jenny, my joke with my patients, because they're all upset about their weight mostly, is that COVID-19 was named because everyone gains 19 pounds. And for the most part, most of my patients have adults, especially between 15 and 20 pounds, kids too. And so nutrition is huge. Early on with this stress, one of the ways people were coping, I will add myself to this, is through comfort food.
Sure.
Simple carbohydrates, cookies, donuts, cake, ice cream, whatever, pasta. So nutrition is huge. And I think as one of the things that we know is if we treat our food as medicine for us, that we are going to feel better and have more energy and be able to do more things. So when we eat healthy and avoid some of those things and concentrated sweets that just add sugar and inflame our joints, that we're going to feel better and be able to do more and be more active. And I think that should not be overlooked in terms of our health.
Great. And thank you to who wrote in to remind us of that. So thank you, Dr. Kellett, for your time this morning. A really important topic that I think we're just beginning to navigate through. And so might have other opportunities to continue to revisit this. But your reminders of patience and the grace that we can continue to show one another and those in our lives to help through this time are really appreciated. So thank you again for your time today. Thanks to everyone who joined us. And we'll be back in the future with more timely topics in Family First Health's health briefings. Have a great day.
Thank you, Jenny.